For thousands of years, people from different cultures around the world have used drugs for medical, pleasure, culinary, spiritual, and other ceremonial purposes. It is only in the past 100 years or so that certain drugs become internationally prohibited, and political, economic, and ideological agendas framed a vision for a drug-free world. This impossible goal has led to the dominance of war on drugs approaches adopted by governments around the world. It has had devastating consequences for the lives of many people, especially those who are marginalized and racialized. Among them are people who use drugs who are extensively criminalized, punished, and stigmatized. However, more and more governments, UN agencies, scientists, and academics around the world are calling for the reform of drug policies to decriminalize the use and possession of drugs and other related activities. In consultation with advocates around the world, the IDPC has developed a guide to advocate for decriminalization. It will take you through 3 key stages in doing this advocacy: know it, show it, and grow it. Join us in working towards ending the criminalization and punishment of people who use drugs. So what is decriminalization? According to IDPC's gold standard, decriminalization means the removal of all forms of punishment for the use of drugs and activities relating to personal use, including possession, acquisition, purchase, cultivation, and possessions of drug use paraphernalia. It also means the expungement of prior criminal records for drug use and ensuring funding to enable access to voluntary drug treatment, harm reduction, and social welfare services. The consequences of criminalization and punishment for drug use are devastating, especially for people who are in situations of vulnerability, for example, due to poverty, racism, and gender-based discrimination. Decriminalization reduces the cost to governments of punishment and criminalization by removing the requirement for criminal justice institutions to target, arrest, and punish people who use drugs, and redirecting funding towards services and systems that improve health and social outcomes for people who use drugs and their communities. One important question about decriminalization is how to distinguish between the possession and cultivations of drugs for personal use on one hand and drug trafficking on the other. Establishing threshold quantities is one method. When a person is in possession of a quantity of drugs below the threshold, no penalty or punishment applies, but determining threshold quantities can be complicated and must be used carefully. Threshold quantities should only be used as an indicator, not a conclusive factor, in determining whether a person is in possession of drugs for personal use or trafficking drugs. To grow the support you need to advocate for decriminalization, a good first step is to find others to advocate with you. And be prepared to seriously address concerns that may be raised by other people. Decriminalization is not a silver bullet for solving all problems relating to drugs. However, ending systems of criminalization and punishment that have been damaging, costly, and ineffective can make a vastly positive difference to the lives of people who use drugs and their communities. To learn more, take a look through our user-friendly guide to advocating for decriminalization and other resources on the IDPC website.